welcome, and thank you so much for joining us today. My name is Doily K. Gottlieb. I'm delighted to open the fourth webinar in the European Health Union Initiative series that the European Health Forum Gastein has been co-organizing with the European Observatory on Health Systems and Policies in the course of this year. Today's webinar will follow up from the Gastein discussions where we called for a moonshot for a true European health union. And it is also linked to the joint EuroHealth publication on the same topic. The development of the European Health Union since its launch by Ursula von der Leyen in September 2020 has been exciting and has, of course, been watched very closely by the European health community. And another milestone just happened yesterday with the launch of the EU Global Health Strategy. Today, we will look specifically at how the European Health Union supports member states in strengthening their health system resilience, and we'll hear the perspectives from different stakeholders on where we stand and how they work together. And we're delighted to have the Austrian Minister of Social Affairs, Health Care and Consumer Protection, Johannes Rauch, with us today, who was also involved in the discussions in Gastein earlier this year. And actually, the Austrian ministry organized a session on funding mechanisms and other innovative solutions contributing to a more sustainable and efficient and thereby also more resilient health system. Just a quick note to our participants, if you could please use the chat function and I will then later on bring in your questions and comments. And that just leaves me to hand over to the trusted hands of today's moderator, Matthias Wismar from the European Observatory. I look forward to the discussions today, and I very much hope you will enjoy today's event. Thank you, and over to you, Matthias.
Dolly, thank you so much, and good afternoon and welcome to everyone. And I think this is a really important moment, and we are quite excited because haven't we seen an amazing response from the European institutions with regards to COVID-19? We've seen the mobilization of budget, existing organizations, the creation of new organizations. We have seen the introduction of new policies, and as you say, Dolly, just yesterday, a new strategy, and all this under the umbrella of a European Health Union, and much of it, quite some of it actually, to strengthen the resilience of European health system. So I think it's a very good moment, more than 2 years after the speech of Ursula von der Leyen on European Health Union, to take stock, where are we actually with European Health Union, with strengthening the resilience of European health systems. So I'll guide you today through the webinar, and we've structured in 2 blocks. The first block is a bit of a conversation between the Austrian minister and Maya Matthews, the director from DG Santé. And after this conversation, we will have panel discussion with stakeholders, experts, other politicians, and you will also have the opportunity to use the chat. Please be reminded, we are recording this session, and after the session, you will receive an evaluation, and you would do us a great favor if you could fill it in. It helps us to understand, what are your expectations and how we can improve in the future. Now, let me introduce the excellent speakers we have today. We have Johannes Rauch, Austrian Minister for Social Affairs, Health, Long-Term Care and Consumer Protection. And that's quite a portfolio. It's a mega ministry, actually. Johannes Rauch is responsible for so many different aspects and also a huge budget. And we have asked him to join this webinar because we know that Austria has been particularly skillful and engaged in using European tools and instruments to strengthen the resilience of the health systems and to advance health policy reforms. The other speaker we have today, and I'm so grateful that she is joining, is Maya Matthews. She's acting director, DG Santé, for Digital, EU for Health and Health Systems Modernization. And these are all the elements, actually, which we want to talk about today. EU for Health, the public health program of the European Union, it has grown substantially, I think more than 11 times the volume of the previous budget. Health system modernization is exactly what we are talking about when it comes to health systems resilience. And digital is, of course, a very, very important aspect of it. So that's for the introduction. And now, Minister Rauch, please forgive me if it is a little bit blunt, but maybe I can ask you really directly, what has the EU actually done for the Austrian health system, for Austrian reforms? How have they supported you? Please, Minister, the floor is all yours.
At first, good afternoon, everybody. It's a pleasure to be with you. I guess the question also could be, don't ask what the European Union can do for Austria, ask what Austria can do for the European Union to stay unified. But the European Union has done a lot to support the Austrian reform efforts. Austria implemented structural governance reforms between 2013 and 17. These laid the groundwork for organizational and structural changes within the health system. Austria leveraged 3 types of European Union support to advance the implementation of these reforms. First, technical support from the Structural Reform Support Service. The SRSS has supported Austrian policymakers with tailored startup services to encourage health professionals, especially young doctors, to establish their own primary healthcare units. The support provided since 2018 has included hands-on consultancy services to develop business plans, a startup guide. This emanation strategy to attract professionals, training sessions for regional administrators. Second, loans and financial advisory services from the European Investment Bank, very important. Secondly, the Austrian government pooled financial support from the European Investment Bank and other partner banks in Austria. Third point, funding for primary healthcare from financial instruments, including the Recovery and Resilience Facility. Austria has recently pledged 100 million towards its primary healthcare reform and its national recovery plan. The allocated funds from the Recovery and Resilience Facility will continue to support the establishment of new infrastructure. Additionally, we are focusing on promoting the digitalization and improving the environmental sustainability of existing facility. So the answer in short is a lot, a very lot.
Thank you so much, and it's quite impressive. I understand that Austria already started to use tools well before the crisis and well before the crisis responses, but you also have used tools which are just available since COVID-19 responses. And some of the tools are more technical in nature, but others are also financial and support really the development and investment in infrastructure. Thank you so much, Minister Rauch. Maya, I would like to come to you, and my question is, I mean, you've always been working very closely with member states, and what we heard from Minister Rauch is that some of them are really very concrete tools, you know, which can be seen, you know, at the grassroots level, actually, in the implementation. But now that you have such a big budget and so many additional tools, you know, how has your work actually changed with member states? Has it intensified?
Thank you very much, Matthias, and good afternoon, everyone. It's a pleasure to be here. Actually, yes, I really love your question because I like the way that you said it's not like it's all starting from scratch. We've had a long relationship with member states, but definitely the COVID pandemic kind of accelerated the intensity because of the need that all of a sudden health was in the spotlight. And we realized, and all of the people I'm sure listening are from the health community, we always knew how central health was to society and to economics. But I think now the whole world knows that. And I want to give 2 examples of how our relations with the member states in health has indeed intensified. And one of them is on the Recovery and Resilience Facility. facility that the minister mentioned. I think, I don't know if everyone is aware, but this is one of the biggest funding instruments. It was created as a direct consequence of the pandemic, with about 700 billion euros available to member states to basically build back from the pandemic, with a focus on digital transformation and green transition. But health is a key component in that. And what we've seen now is that every member state has produced a plan. Like the minister said, for Austria, the plan is very much focused on primary healthcare, the continuation of the reforms that they've done, and digital. But what I can say now is that every plan has been adopted now. 27 plans have been adopted, with the last one, Hungary, just being adopted yesterday by the Commission. And each of these plans has a health component. And at the beginning, we didn't know, because this is a bottom-up. It's up to member states to decide where they want to put their money. So I think that already shows you a little bit of the thinking that for all member states, health is absolutely an important part of the future development and the response to the pandemic. In general, there's about 40 billion euros being invested in health through this recovery and resilience facility, which dwarfs any other EU instrument, which is why I wanted to make the case and mention it. And again, it's very varied, which it should be, because it's tailor-made to the specific context of each member state, where they see the need to address their reforms and investments in health. As you said, our relations with member states have intensified, and until recently, we didn't really have a fora to discuss with member states health systems. And so under the Slovenian presidency, in council conclusions, we used an existing expert group called the Health Systems Performance Assessment Expert Group, and kind of revamped it to create a group where we could discuss innovations in health together, and to kind of share all of these changes that have happened in an environment where it's open to sharing best practice, but also where we can bring quite technical knowledge about the performance of health systems. So to finish, I think what would be very important in our new and more intensified relations is, from the Commission side, to facilitate and support member states in using and maximizing the opportunities available for EU funds. And as the Minister from Austria said, Austria is already a kind of front runner in showing how to do this. Thank you.
Maya, thank you so much. But that's really great news, because at the time, Austria was kind of ahead of many others. One was a pioneer actually in using systematically EU tools and funds. And now hearing from you that so many member states are actually including health in their recovery and resilience plans, that's actually very good. And it also points a little bit into the future, that we are probably seeing activities over the next couple of years, and that you will continue to work with them very, very closely. Thank you so much, Maya, for this. Minister Rauch, this session today, the webinar, we were talking about the European Health Union, and we all know that 2 years ago we had this landmark speech from the President of the Commission, Ursula von der Leyen. What does it mean to you, European Health Union? It's something new actually for member states as well, because in the past we would never talk about a European Health Union. It just came on the table, you know, with COVID-19 response. What does it mean to you, European Health Union?
I'm in favor of the further development of a strong and sustainable social and health union, because well-developed and accessible social protection and health systems in Europe are essential to address current and future challenges. The common approach of the European Union to the recent challenges of addressing COVID-19 has proven its worth. We saw, for example, the speedy production and procurement of vaccines, especially preventing bottlenecks, and the development of the European Green Pass that facilitated travel throughout the continent. The goal must be to continue to make the best possible use of such common structures in the future, because we are facing new challenges. We are in the midst of a perma crisis. In view of this perma crisis, we discussed it in Gastein, namely the war in the Ukraine, the climate crisis, pandemic, with all its social and health consequences. Actually, the energy markets, which rise up the prices for everybody in households, especially in vulnerable households, with impact on health for anybody in the system. The EU and its member states find themselves in particularly challenging times, we know. The effects of events such as the climate crisis and the war in Ukraine, as well as pandemic preparedness, do not stop at our national borders. And it is only by working together that we can achieve results. For example, we need to sustainably strengthen a more independent Europe in order to move away from fossil fuel energy. Sidestep, Austria has a dependence on Russian gas by 80%. It's a horrible thing, actually. And thus also from geopolitical dependencies to be able to guarantee more sustainable security of energy supply at fair prices. And finally, we need a strong social Europe, in particular, where it comes to combating poverty and the right to universal health care, no matter who you are or where you live in Europe. We need a stronger commitment to implementing the European pillar of social rights at all levels. Well-developed social protection and healthcare systems accessible to all are essential for crisis management, and their functioning is a measure of resilience and ensures social peace.
Thank you so much, Minister Rauch. I think there was a very strong and very clear statement that the learnings from COVID-19 and the responses to COVID-19 are very, very clear. We need to act together, and we need to see that we act throughout Europe. And there's not just the health aspect in it. As you say, we have so many different crises, the perma crisis, we cannot say what will be the next one. And that there's always a very, very strong social aspect in it, a social gradient. Even in health, we see it that it emerges, that we have equity issues when it comes to helping the people. So thank you so much for this statement. Maya, it may look awkward to ask you, what does DG Santé think about European Health Union? Because you created it, you have a website on it, but at the same time, I need to ask you, because I mean, Ursula von der Leyen's statement was 2 years ago, and the situation has evolved dramatically, actually. And you have now all these policies, instruments, budgets in place. You start to see how they actually work, what effects they bring about. So how do you see European Health Union now?
Thank you, Matthias. Yeah, I mean, let's start with the fact that it was Ursula von der Leyen who basically, it was a rallying cry to member states, but also a recognition that, enough hadn't been done, and that we all had to work together, member states and all stakeholders, if we wanted to actually benefit the people, the general public, the patients, because in the end, we're not just doing this for bureaucratic reasons, we're doing this so that people in Europe have a better health, universal health coverage. These are all principles that we've been working on. So I think it was a very smart move to put this very simple, it's only 3 words, but it has launched a whole discussion, which obviously people like myself, who's been working in this field for over 20 years, the simplicity of it is actually, I think, what's been its success. Because of course, in the beginning, in the aftermath of the pandemic, the focus was on building a new EU health security framework, which we have now done very successfully. But this is only part of the picture. And because the title of today's webinar is about the resilience of health systems, the resilience of health systems is a very long-term thing. And that's why the European Health Union, I want to make very clear that the European Health Union is not only about resilience, it's about long-term sustainability. It's about looking at the general health status, bringing in, of course, the social determinants. And so we would see it more as a kind of building a beautiful structure. And we've got many building blocks, many parts to add to it, such as the Beating Cancer Plan, the pharmaceutical strategy. Now we have the European Health Data Space. These are all, I think, incredibly creative, innovative, and effective policies that together will really provide Europe with a wonderful model where it shows that where needed, so where there's added value, to use the jargon that we always use, we are working together on health. But at the same time, I think it's also important that we're not trying to make a mega health institution. You know, we have to recognize also, and I'm a very strong believer in this, we have to recognize the contextual nature of health. And so what's beautiful about the European Health Union is that we're putting together pieces of the puzzle where they can be a real difference for better health in Europe.
Maya, very clearly, it's a holistic perspective, but at the same time, very problem oriented, actually. So it's not adding stuff because for the sake of adding stuff, but it's rather to see where's the problem, what is the crisis, how can we strengthen, how can we add value? That's the perspective. And therefore, European Health Union, as I understand it from you, will evolve over time. And that's actually the perspective. Thank you so much. Minister Rauch, my last question to you. You were talking about your experiences with EU support tools, and also the new ones now from the Recovery and Resilience Fund. How can the EU still help you? I mean, you said very clearly, don't ask how the EU can help you or how you help the EU, but still, I mean, we all want to see that value is added and that citizens, systems, health professionals benefit actually from European Health Union. So what can the EU still do?
First, let me say, I guess the pandemic changed our mindset all over Europe, and that is the most important change in mindset in the last years. So interestingly, most of the support instruments mobilized for the Austrian reform were not inherently geared towards supporting projects in the health area. Consequently, identifying, applying for and combining these tools for health system reform required substantial proactive engagement from Austrian policymakers. It is important to point out that the Austrian success in this area currently represents an exception to the rule. EU member states, health ministries, regional and local authorities generally lack the resources, capacity, and expertise for the process of using multiple different EU tools and combining them actively. Exactly, this need is addressed by the recently launched technical support instrument Resources Hub for Sustainable Investing in Health, a joint initiative by Austria, Belgium, and Slovenia, aiming to pilot a health resources hub supporting the 3 member states in reaching EU funding that is available for strengthening public health systems. Such a systematic support process of accessing European Union funding mechanisms could greatly improve the synergies between available instruments and enable member states to better choose those instruments most suited to their goals. Consequently, contributing to making the case for investing in health systems towards their governments. We need to continue to highlight the positive socio-economic returns of health investments. And let me say, we should use the word investment and not cost all the time. I discussed it with my Minister of Finance the last weeks in a very strong way. In summary, many of the challenges faced by European health systems require changing the status quo. Propelling investment in health systems will require more EU support geared specifically towards the reforms of health systems, at the same time strengthening health policymakers' capacity to advocate for investment and to access the right EU instruments to support their reform processes will be equally crucial steps to strengthen European health systems and to move towards a stronger European health union. Thank you.
Minister Rauch, thank you so much. And I think there were many very important points in what you just said. I would just like to pick out two. One was the last one on the narrative. I think throughout Europe, we need to be very clear. We're talking about investment, investment where we will have returns on, because health protects us and protects our economy. That's very clearly. But the other thing is also very important. And I think it links into your earlier remark. Don't ask what the EU can do, ask what you can do for the EU, because I think it's, as I understand from you, it's a two-way process. We also need to be prepared, have the mindset, but also a little bit the infrastructure to absorb the help which is coming from the European Commission, from the European programs, because we all know administrative processes can be sometimes quite complex. There's a lot of programming behind it. It can be difficult to combine different instruments. So we need to have the people also at country level who can help stakeholders, healthcare providers, regional ministries, local administration to make use out of all this stuff. Thank you so much, Minister Rauch. And I invite you to stay with us a little bit longer if you wish, but we understand that you have to go quite soon. Maya, it already points into the direction, how do we make this actually sustainable? Because, there are some commentators, they say, oh, these unprecedented levels of budgets, it's great, but will the member states for the next budget negotiations, will they still be happy, or will they go back to earlier budget levels? What will we need to do to demonstrate the added value of this additional investment? How do we do this? Do you already have some ideas, Maya?
Well, I think that if we zoom back a little bit, I think that the whole area around EU work on health, I think that first of all, the member states have to see an added value for them. They have to see, as the minister said, it's what they can get out of it, but what also EU can get out of it. So I think that they need to see a benefit in working together, and I think that the pandemic has shown that. But there also, maybe more importantly, is that European citizens, the general public, they also need to understand a little bit more, or know what EU can do and what EU can't do. And I often use two examples. One is the blood. I think many people don't really realize that the safety and quality of blood and tissues and cells is actually regulated at EU level. So if you have a blood transfusion in Lisbon or in Bucharest, you should be having the same quality and safety standards. I think these are important messages where it makes people then realize the benefit of investing at EU level in health. The other very important issue, I would say, is better information and data. I mean, we all bang on about it, and we saw that with the COVID pandemic, how much we needed data and information. I think that's key, because it's also part of our communication and the narrative you were talking about. If we don't have good data, if we don't have comparable information to be able to share, it's very difficult then to see the benefit perhaps in engaging. And as you said, it can be very time consuming to apply for all of these projects, to go to all these meetings. And here I'm going to do a shameless plug, because on Monday, we are launching a Health at a Glance 2022 publication with the OECD, and it's part of a project with the observatory that we've worked on for many, many years called State of Health Cycle. And there, every 2 years, we produce this publication which provides you with comparable data. And this is really for policymakers and for the general public. So I would say communication, information, and then, of course, the whole issue about solidarity for people to realize that working together, you know, we will be able to make hopefully we will be able to make more inroads in many of the health challenges that we are faced with today.
Couldn't agree more, and I'm very happy that you say this. I was actually yesterday with Commissioner Nicolas Schmidt, and he was quoting the country health reports, the 2019 versions, because they had a focus on the health workforce, and we were talking health workforce, which is a topic very close to his heart. So you see that it also informs the Commission insight to discuss what are the issues here. Maya, thank you so much for joining us, and please, I would like to extend the invitation and stay with us for the panel, and I guess there will be some questions coming through the chat, and maybe you want to respond to them as well. Now, it's time for our panelist round, and I'm very happy to introduce, to present our panelists. First of all, Ricardo Batiste Leite. He's a member of the parliament in Portugal, and many of you will know him. I was joking with him in the preparations, asking him, Ricardo, you are a seasoned parliamentary. Is it your third term? And said, no, Matthias, it's my fourth term in the parliament, actually. And in between, I was deputy mayor in Cascais. So quite something. Very interesting to hear this also now from the perspective of the national member of parliament. Please, very briefly, 2 minutes reflection from your side, what you just heard. And I would like to invite the other panelists as well to join now. Please, Ricardo.
Thank you so much, Matthias, and thank you to you and to Dorley and to Gastein for also the very kind invitation to be here and such a stimulating conversation with His Honourable the Minister and also with Maya Matthews. And I think that a lot has been said here that is worth discussing now as we move forward. And you know, I always look at these issues from my multiple hats. You mentioned my policy side, but right now it's more or less halfway point in my career where I worked half of my life as a practicing physician in the field of infectious diseases and also in academia. And, you know, it really resonated to me what the minister said when it comes to the importance of concrete tools that are presented in a systematic way, in a way that can be used to push for concrete results. And I think the minister said it all when he said that such tools can be powerful for ministers of health and social affairs in governments to help convince their cabinet members, to convince their prime ministers and presidents that there is a need to invest in health. So there is this is a very powerful tool that the European Health Union, that the Commission has to actually accelerate health reform, because one of the major problems that we face in most European countries is that ministers of health do not have enough political leverage and power within cabinet to move the agenda forward. And you know what Maya also mentioned around the importance of the recovery and resilience plans that are being pushed forward is actually another demonstration of this. And we know that these plans have the potential to push for reform, as they've done in Austria, but there is a risk that that may not happen. And I give you an example from my own country. We envision 300 million euros for digital transition, but if we do not use that wisely, we will just end up keeping the same procedures, just going from analogic to digital, when we actually need to make sure that we're moving in the direction of true reform to achieve the goal that Maya stated out more holistically of what we aim to achieve with the European Health Union, which is sustainability. And sustainability, when it comes to our health systems, demands lowering the burden of disease. There is no other way. We need to make sure that diseases that are preventable are prevented. Diseases that are curable are cured. we need to make sure that we are capable of providing the best access to care. We are capable of having the most effective prevention policies out there, and making sure that quality of life and well-being are at the core of everything we do. And the truth is, we do not have health systems, as we've said many times. We have disease systems that spend most of our resources reacting to situations that we could have avoided earlier on. Another issue that I'd like to point out, because I think it addresses what was mentioned by both Maya and the minister, is the opportunity that I think that we can actually use this kind of European tools and funding to maybe accelerate even more domestic funding for health. So we should use these tools to create match and mix systems in which for every European euro invested, we can include another domestic euro in health. And potentially this could actually be used for the private sector too to invest, as we know is very important. And the Global Fund has been doing this very, very interestingly. To end, I would say that the minister pointed out also the importance of good examples that we have seen with vaccine procurement with the Green Pass. There is potential moving forward. I think that there are some examples where we have some low-hanging fruit, such as creating within the digital transition, standardizing health indicators so we can measure and compare health outcomes and make sure that we're all moving in the direction of creating health value, creating systems that actually promote well-being of all citizens, but also other areas that the European Union has tried to create more of a European approach, which is rare diseases. It's a no-brainer. We all need a critical mass when it comes to that. And the European reference model for ensuring reference centers can be a very important tool that we can accelerate in areas that I believe can generate greater consensus among all citizens. To end, Europe universal health coverage was mentioned. I think it is a very ambitious goal. COVID, now the war in Ukraine, has pulled us back instead of forward in achieving that and the sustainable development goals. We truly need to accelerate the agenda to catch up what we've lost. And I believe that I think both Maya and the minister mentioned the importance of poverty, of understanding the mechanisms of solidarity. And in that sense, to say that universal health coverage will only be achieved if we involve all vulnerable populations. And so civil society organizations, citizen participation have to be part of this greater vision for Europe. And I'll stop there.
Ricardo, thank you so much. That was a very rich account of what you have seen. But I take a couple of points from you. Number one is, I think you said in different words that the European Commission, the European Union can actually be a pacemaker in the changing narrative. You know, that we don't fall back into austerity when it becomes difficult financially, but that we really talk about the investment. And also because it has some money, it can support actually the start of the investment. Of course, it will not be the only source, but it's one of the sources of seeding money, starting money, whatever, which can start the entire process. And also we need to talk more about good examples and successful examples. So do good things and talk about it. Thank you. We will have another round of questions. So Ricardo, don't worry. The next panelist I would like to introduce is Sarada Dash. Sarada is a long-term Brussels person, and she is actually the director, the Secretary General of the Standing Committee of European Doctors, CPME. And with this, you are actually representing one of the most important and one of the most powerful professional groups in the health systems. And we are all clear, you know, without a strong health workforce, there cannot be any health systems resilient. So Sarada, what are your reflections from the talk of the minister and Maya?
Thank you very much, Matthias, and thank you very much for giving us the opportunity today to comment. So I think that we all agree that the introduction of this concept of the European Health Union was very necessary and very welcome. And CPME, of course, was also very pleased to have this vision for our health systems coming out of the pandemic. We see that a lot has been done to deal with the post-pandemic preparedness, but then we look towards the health systems overall and actually see still a lot of need for action. And especially when it comes to the health workforce, we have to say that really we have not left the crisis mode yet. in order to be able to provide sustainable patient care, we think it really needs at EU and as national level, we've already heard investment, but also policy action to ensure that health systems and health services can continue, because we actually see deterioration. You mentioned the health at a glance. I'll be very interested in seeing that, because from our membership, we hear increasing levels of burnout. We hear really an extreme burden when it comes to dealing with not only working on the backlog, which built up during the pandemic, but also now facing the new health problems that are occurring from the socioeconomic context we're living in. And plus, looking to the future, we really see a recruitment and retention crisis. So we really would like to share this hopeful future, and we do see that a lot has been done, but we cannot rest here. And maybe just to give one example of what we saw, we've already said that we still see continued health inequalities in the healthcare systems, and we see continued problems with accessing healthcare. And actually, one of the very concrete measures that we would have liked to have seen now moving a little bit into a more reflective phase of how to solve this is for the Commission to give very concrete recommendations to health systems or national governments on minimum capacities that need to be built up to, on the one hand, to be able to ensure universal health coverage, but also to ensure future emergency response. And this is really an idea which arrived from our members' reflection on the pandemic, where we saw that health systems basically moved to a just-in-time kind of functioning, so that resources were moved to a level which were very economically driven, but not so maybe patient care driven, and created working environments for health professionals which are no longer sustainable. So our pledge is to really move to a just-in-case way of thinking about health systems, to build future capacities for emergencies, but also especially stabilize healthcare systems and the healthcare workforce in normal times.
Sarada, thank you so much. And thank you for reminding us that a lot needs to be done in countries protecting health workers, actually, the physical protection against, virus, harm, violence as well. But also there is the mental protection. People were, as you say, we had a lot of burnout and people were exposed to situations during COVID-19, which were unseen before. But there's also in many countries social protection, that in case of ill health, they are not sufficiently protected, health workers. And I'm very happy and very interested to hear that you see further roles actually of Europe, when it comes to capacity planning or capacity indicators, and discussing it, what should be minimum levels across the European Union. Thank you so much. And now it's my great pleasure to introduce my colleague, Nicole Mauer. Everything what I've learned about EU tools, I've learned from her, actually, because she's been trawling through an unbelievable amount of documents, websites, trying to systematize it and bringing them together and seeing, what sort of tool is good for what sort of purpose. Please, Nicole, your reflections on the first round of discussions.
Thank you, Matthias, for that introduction, and also thank you to Gastein and the Observatory for having me today. I think we've already had a wide range of contributions, both around the usefulness of these tools, but also obviously on what still needs to be done and how maybe these instruments can help us with achieving that. So I think I'm going to use my 2 minutes to just reflect on the instruments again, and just maybe summarize what we've heard and echo some of the things that were said. Firstly, I think we've seen that the scope and the financial aspect of these instruments has enormously changed and evolved as a result of the pandemic. And the Austrian example is the best one to show us that they can have added value at national level, and they can be combined effectively with national resources when needed. However, I also want to acknowledge the challenges that were mentioned. Obviously, for health policymakers at national level, it's not always easy to know what is available, in which policy area to look, because many of these instruments, as we heard, are not geared towards health systems specifically. This lies this is also the result of the EU having a complementary competence in the area of health, and that many of the actions that are performed are a little bit fragmented and might be anchored in different policy areas. So another point that I wanted to make is that European tools cannot really support health systems with the running costs of health systems. And that might make it even more challenging for policymakers to make a case and say, look, we need to access this money, because they might work in ways that are not directly intuitive. So they require some level of creativity, and they require people to know where to look, and they require policymakers to know how to use them, how to access them. And I think the positive takeaway from today's discussion is that there are mechanisms starting to being put into place that can help us with using these instruments. So as Maya mentioned, for example, the HSVA expert group as a forum to talk about health systems, or the TSI as a technical support instrument where member states can go with their reform ideas or issues or country-specific recommendations they've received in the European semester and say, we would like to do this, how can we do it? And finally, the Austrian upcoming project with Slovenia and Belgium, where this type of support will be tailored specifically towards health. So it won't only be the TSI, but a hub where we can really come with, for example, we have an issue with our workforce. How can we train them more effectively? How can we support the mental health of the workforce? And then the resources hub can provide tailored support for that. So I think that's a very good first step in the right direction. And yeah,
thank you so much, Nicole. And I take it from you, it really does has to do something with mindset in member states, but also with absorptive capacity, being able, to make some sense and some use out of it. Before we go into the second round of panel discussion, I would like to bring you on board, Dolly, again. And I know that you have monitored the chat box, Dolly. What has come through? Can we feedback something to the panelists?
Yeah, thank you, Matthias, and a big thanks to all the speakers. It's been interesting monitoring the chat because I think it showcases very clearly what the big issues of our times are. And one of the major issues was the situation of healthcare and healthcare professionals. So how do we ensure the sustainability and the resilience of the healthcare sector? And that was specifically asked regarding palliative care and its supply chains, but also about a vision of a future role of healthcare procurement was in the chat, and how we can make sure that the role of future health professionals remains future-proof and sustainable. So that was on the one hand, on more or less on this topic. And there was also an interesting question on the global perspective. So are there any plans of scaling up the European Health Union to a global model, or learning from other parts of the world, like Latin American Health Information System or India Citizens ID? So that was the other side of it. And we received a couple of questions beforehand, and they were very much focused on health systems. And one of them was centered around, are member states equally equipped to pick up funds, or do we need to focus more on the governance of member states? And in this connection, also the topic of corruption was mentioned. How do we ensure that funds do not go to any corrupt bodies? And one more topic was whether prevention should not be taken into account also when granting these funds. So more or less,
thank you so much, Dolly. That's what I've seen so far. These are really key topics. And I mean, the health workforce, we are talking all year about the health workforce, about the aging of the health workforce, about the problems of retention, and also the medical deserts where you have difficulties of access, of course, And then the question on, are we equipped to deal with all these new tools and with the monies or the corruption issue? It's really what I think Ricardo actually said. We have to be careful not to use the money for the same old stuff, but really doing something innovative. And the last one was the prevention. So please, each of the panelists, pick out the question you feel best suited to respond to.
Maybe, I mean, there's a lot of different questions, but maybe this kind of governance element is a little bit common to all of them. And there, I would say that we really need to see action at grassroots and at the very top level. I think on the one hand, we've said a lot of money is being spent. We just recently had a conference with our membership on, for example, Recovery Resilience Facility, and saw that the level of engagement of stakeholders differs greatly. So some of these decisions about actually where to make these investments is made at a political level rather than at one where people, patients, professionals from the healthcare systems are able to provide input. And this is somewhere where we really see an opportunity for improvement. The other end of governments, I would like to go to the very top level. And this was already mentioned by MEP Leite, that he was saying, actually, ministries of health sometimes lack the leverage. And actually, all of these things I've been saying are not contested in the health system. Everybody knows all of these issues, and actually the data also shows into a very clear direction. But there is perhaps a lack of really top political buy-in to make a change here. And that's why we believe that health needs to stay on the very highest political agendas, even if the immediate urgency of the pandemic has maybe now been overshadowed by other urgencies which are affecting our societies. But we've seen that stable health systems are the motor of functioning socioeconomic systems. So we hope that this top-level political interest will not wane, and there will be continued support to make these important policy decisions.
Sarada, thank you so much. If I understand you correctly, you emphasize that the governance will be a key lever, to make all of this a success, actually. And without good governance, it won't work. And we are not quite there, if I understand you. So we need to keep the activity level high for a while, that we can reform and improve our governance, and also that, as you say, the buy-in from some top-level policy makers is really fully assured. Ricardo, may I ask you as the next one? We had the questions, the health workforce, the governance, and the prevention, and there was also, I think, an issue of learning from other regions. Well,
the health workers challenge, I think, is the greatest of all, to be honest, because beyond everything that both Sarada and Nicole have already brought to the table, which are already challenges of their own, there is then the global market that is currently working. And, and I think it was 2017 or 18 that Portugal exported as many nurses as the ones that were actually trained in our own country. And we are way below OECD average when it comes to the ratio of nurses that we need in our health system. That's just one very concrete example of how even a country that is investing through its public health education system towards training, then we are failing to retain, which I think should raise a lot of questions from whoever is running the Ministry of Health, so to say. Why are we unable to motivate these people to stay? And we need to address this issue from a bottom-up perspective also. It's not going to go just with incentives coming from the top. We need to have very thorough understanding of what motivates health workers to want to work in health systems. And actually, I think in creating these kind of tools that can help us, as Sarada mentioned, create the minimum needs requirements for health systems can actually be a very important tool to make sure that governments address this more seriously. Another topic I'd like to mention, based on what we heard, is around the European role when it comes to pandemic prevention, preparedness, and response. I think there is right now a very serious negotiation happening led by WHO. The zero draft of the pandemic treaty has already been shared. And I believe that the European Union not only can, but must play a leading role in the negotiation process, making sure that accountability mechanisms, that financial incentives are put in place because we saw with COVID-19 that the international health regulations and even European rules were insufficient to deal with such challenging cross-border health threats. And so this is a unique opportunity as we are still in the pandemic, but phasing out, to actually not lose momentum, to provoke the changes. And I think that if Europe doesn't lead the way, no one will, to be honest, in the global scale. And that leads me to the last issue that I think is extremely important, which is many times in the policy space, we are reinventing the wheel. We are dealing with a problem and we try to find in the literature some kind of legal policy solution that's out there. Many times the fact is most literature is Anglo-centric, and there are very interesting policy examples being developed in parts of the world that nobody knows about because we do not have that kind of networking being done by policymakers. And so that's actually something that my organization tries to promote a bit, through the Unite Parliamentarians Network for Global Health, bringing parliamentarians from around the world together. But this is something that I think the European Health Union, establishing partnerships with other regions around the world, we can try to make the most of that kind of collective intelligence and then use that to fuel health system reform, using the European Health Union as creating standards of good practices and then helping countries in the adaptation of those good practices to their own contexts.
Thank you so much, Ricardo. And I understand in the health workforce, we also need to do our homework actually with recruitment, retention, avoiding medical deserts. The pandemic treaty, you heard, yesterday the EU global health strategy was launched, and there's a lot of stuff in it for us. And not reinventing the wheel, it's something we are saying all the time. Let's share what we actually know. Nicole, very briefly, sorry for the rush.
That's okay. I'll try to address more than one thing in 1 minute. I just wanted to pick up what both of the speakers were saying about the window of opportunity and not losing momentum and how we can achieve that. And I think the key really lies in making a case for and calling attention to these interdependencies that we have across different policy areas. So just making it clear to the decision makers that investing in health is ultimately what makes societies more resilient and economies prosperous. And in that sense, the Recovery and Resilience Facility is one of the instruments that we can use, for example, for prevention. Some countries have dedicated money to strengthen primary healthcare, community healthcare, and there is a real framework to assess the implementation of how this money will be used and how it will be implemented at national level. And I think that by making evident how much I would say by showing that these indicators work and that the money that we use actually strengthens the resilience. So we need to be able to monitor that in a better way. By doing this, we can also make the case for investing in health systems. And this requires showing that, okay, the money might not be there for health initially, it might be born in another policy area, but when we use it for health, we actually have good outcomes, and that not only strengthens the healthcare system, but by preventing diseases, we can also strengthen the society in other ways. Or by, for example, funding infrastructure, we can improve the environmental sustainability of the entire system, and in that way.
Nicole,
sorry.
Thank you so much. But
Wrapping
there's a clear plea for more transparency, better data, and better analysis, actually. Maya, can I ask you to come on board? First of all, thank you so much to our wonderful panelists. And I would like to wrap up this together with you, Maya. My only sentence here is actually what I learned from today is that making the European Health Union a success depends on both sides. Not only the Commission, its programs and budget, but it depends on a real partnership. And the partnership lies a little bit in the governance, a little bit in the absorptive capacity, and using the money in innovative new ways and not pouring it into models of the past. But please, Maya.
Okay, I want to just wrap up with, I think, 2 points that I've heard from the chat. It's been really fascinating. It's always really good to hear different perspectives. I want to bring another issue to the table, which is not a new issue, but I think needs to be discussed when we're talking about health systems resilience and sustainability, and that's the whole discussion about One Health. I think it's absolutely key because we always talk about antimicrobial resistance as the silent pandemic. It's already here with us now. So we also need to find a way to integrate on top of the complexity. We need to find a way of how to integrate all of the One Health challenges that we see before us. And then the other issue is, again, the workforce. For those of you who know me by now, you know, for me, this is an area I'm really passionate about. And I liked what Ricardo said. I think that above all, we have to be humble and we have to understand the motivations behind people taking jobs in the health sector. And we need to find a way to try to transform this. So to finish, I would say for the workforce, for the health system, we need to transform and not tinker.
That's great, Maya. And now, Dorley, you can say the final goodbye for our joint webinar. And we hope to see you again, huh? Dorley, please.
Okay, thanks very much. I think we could have gone on for a while also looking at the questions. Thanks very much for them. We will go through them and we'll gladly come back to you directly if we get some answers from our speakers, which I'm sure we will. So big thanks to everyone for joining us, especially to our speakers, but also to all the participants who joined us today. Thank you very much and goodbye.
Thank you. Bye. Take care.